Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Tuesday, November the 10th, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, Brad, thank you and good afternoon. We are clearly in the midst of a second wave, and while we knew it was coming and while we took measures to address it, this wave continues to build at a pace that is no less than alarming. Our focus remains on saving lives, on protecting the health of our residents, especially our most vulnerable residents in long-term care homes and students in school, for example, and keeping our healthcare system from being overwhelmed. Today, Dr. de Villa will outline the recommendations that she is advancing in the face of the rising COVID-19 cases in our city and in our region. She's been clear with me and with all the people managing this pandemic that these actions are needed in order to stop the spread of this virus in Toronto. Our public health officials have worked to address all of the areas where it is possible to come into contact with this deadly virus. Dr. de Villa is laying out these strong and responsible actions that we need to take as a city government and that we need people to take themselves in order to save lives and to get our city back on track. We had extensive discussions. I asked, as did others, many questions, and I am satisfied these are the right measures to take at this moment in time. This is a relentless virus, and we must meet it with an unwavering resolve and a renewed commitment to following the rules. We see the number of new COVID-19 cases in our city continue to climb, with more than 500 cases a day yesterday and again today. As the doctor has said, those case counts don't point us towards relaxing roadblocks, much as we might want to for many different reasons. Our test positivity rate, the percentage of tests that come back positive, has risen from 1.3% in September to 4.8% in the last few days, and the Dr. de Villa will tell you it's gone even higher than that today. Health officials get concerned when that percentage rises over 3%, because then you start to run the risk of an exponential growth of cases, a wildfire of sorts. And we know the positivity rates are higher than that in young people getting tested, and in the northwest part of our city, where some of our most vulnerable and marginalized populations live, and that the positivity rate is getting higher and higher in elderly people being tested. In the last 4 weeks, we've gone from 2.3% to 7.9% test positivity among people over 80. These numbers, together with others that Dr. de Villa will reference, set alarm bells ringing and present a challenge to us to act with strength and with responsibility. On top of those statistics, we are also seeing an increase in long-term care home outbreaks and in hospitalizations. While our hospitals continue to have capacity right now, we know that they are concerned that circumstances could change very quickly, as we have seen in Peel, where their hospitals have been overwhelmed recently by COVID cases. It happened very quickly, which underlines the need for action now before it happens here in Toronto. These are all warning signs that we have seen in other jurisdictions around the world. Peel Region took action because its indicators that track the pandemic are trending in the wrong direction. Next door to us, in Peel, their case counts and test positivity rates remain high. Public health capacity is stretched, and hospitals are at capacity, with some procedures being cancelled. We can't afford to get to that situation in the City of Toronto, or even a worse situation, where another lockdown becomes necessary, as we're seeing right now in England and France, parts of Italy and France, and in Germany. We can't afford to get to that point. We simply must learn from what has happened in all of those other places and more, and then act strongly and responsibly, as we're doing today, consistent with the best practices of all of those places and from other parts of our own country. We need a preemptive strike to avoid giving up all of the progress we had made confronting the virus and reopening to this point. Dr. de Villa has put together a list of actions that would be implemented on top of the provincial red control category starting on November 14th. She is recommending stricter restrictions to slow the spread of COVID-19. I know she does not make these recommendations lightly, and I don't support them lightly. And I know they will frustrate people and businesses. Everybody is frustrated. I continue to advocate for us to find a way for businesses to open their doors safely, and we will continue with that work. But in some cases, that day will have to come a bit later. Given the rising case counts and other contributing factors, Dr. de Villa's advice is that it is not safe to proceed right now in the direction of that safe reopening for some businesses. That's not the news she or I wanted to convey to you, and I know it isn't the answer that many businesses want to hear. But we need to take these unprecedented actions in order to get this virus under control in our city and avoid things that could be much worse. It is, quite simply, the right series of things to do right now, and that is why we are moving today. We are at a crucial point. We're at a crossroads where all of us need to tighten up our own lives to help stop the spread of COVID-19. We need each and every person in our city to act like the virus is everywhere, because it could be anywhere. That will mean attending church and other religious ceremonies virtually, for example, rather than in person. I will be reaching out to the leaders of our faith communities to get their help. I know how important faith and worship are to so many people. We're not asking people to stop being a part of religious services, but we are sincerely asking the leaders and the followers to encourage people to participate virtually for the next while. These measures will also mean the continued closure of indoor dining. I know this will further hurt restaurants, and as recently as this morning, in a conversation with our Finance Minister and Deputy Prime Minister, I offered any help I can to expedite the flow of funds under the very welcome relief package introduced by the federal government, which in fact was passed by the House of Commons last week. The federal government has pledged funding to help businesses, as has the provincial government, help businesses impacted by public health measures. The Prime Minister repeated that again today. And I know from speaking to restaurant owners that funding needs to flow quickly in order to help them. These measures about to be outlined by Dr. de Villa will also mean limiting your social gatherings just to the people that you live with. I join Dr. de Villa in asking people to do this now in order to best protect their own family and friends, the very people who you'd be socializing with, who you don't live with. This measure is being brought forward to protect them and to protect you against COVID-19. Now is not the time for parties. We need people to follow the doctor's orders, your doctor's orders, the doctor to all of us in this city at this crucial time, in order to avoid even harsher restrictions in the near future. I'm asking you as your mayor to listen to this advice, to protect our healthcare system, to protect our city from a fate much worse than anything that we've seen up until now. I know the vast majority of people support doing everything that we can to stop the virus and to get our lives back to normal as soon as we can. We need your help right now in order to do just that. I think Torontonians need to be thanked for their ongoing patience and understanding as our city, just like every other major city around the world, works to confront the greatest challenge that our generation has faced. Dr. de Villa has demonstrated the courage to do the right thing. We should rally around and support her as she brings her expertise and her good heart to trying to do the right thing at the right time. And these measures she will outline today are, in my view, the right thing at the right time. Those of us managing the pandemic here in Toronto stand beside her, difficult as some of these measures are for you and difficult for us. I say all the time, and I hope you've heard me because I really, really believe it and I mean it. This city was one of the fastest growing, most admired cities and most successful cities in the world before this pandemic. But if you think about it, all the things that made us so successful, and we were far from perfect, but all the things that made us so successful, smart people, a great education system, great business, great arts and culture, and a real respect for each other, a real humanity in our way of life, those things are all still there. We've just got to get back to growing stronger and fairer soon. But before we can do that, we must put this pandemic behind us. We simply must do that. We will lead from here. We will continue to work together, including with the other governments, and I know that we can accomplish what we're setting out to do, which is to rid ourselves of this terrible virus. Thank you. And thank you for your patience to the media today as well. I know 4 o'clock news conferences aren't the best, but we had to make sure we had things completed in terms of our work before we came and spoke with you.
Thank you, Mayor Tory, and good afternoon. Earlier this afternoon, I learned that the latest COVID-19 percent positivity figure for Toronto is 5.9%. This means out of all the Toronto residents who tested for COVID-19 between November 1st and November 7th, just shy of 6% tested positive. The spread of COVID-19 has never been greater in Toronto. In recent days, we've seen the confirmed case counts rising to an alarming extent. Today, we're reporting 533 new cases of COVID-19. Yesterday, we reported 504. The total for the past 4 days is close to 2,000 new COVID-19 infections in our city. The temporary restrictions that were imposed last month were meant to create barriers to contact between people in order to limit spread. We have seen some success. In late September, we had seen increased case counts downtown in neighborhoods where socializing was high and that are home to many bars and restaurants. In the waterfront communities and the Island neighborhood, for the period from September 18th to October 10th, the COVID-19 case rate was 275 per 100,000 people. The temporary restrictions began on October 10th. And for the 3-week period ending November the 8th, the case rate had dropped to 49 per 100,000 people. In Little Portugal, another downtown neighborhood with a relatively young population and many bars and restaurants, the COVID-19 case rate for the 3 weeks ending October 10th was 604 per 100,000 people. And by November the 8th, it was 77 per 100,000 people. We don't want to surrender what we've gained from implementing these measures. For most of this time period, case counts remained stubbornly in the low to mid 300 cases per day. In recent days, we've seen local COVID-19 cases rise to more than 400 cases per day and twice above 500 cases per day. Admissions to hospital are rising slowly but steadily. The trend is upward. The grave risk we currently face is evident. More action is required to protect the people of Toronto from the rampant spread of COVID-19. Given the circumstances I've described, as your medical officer of health, I am using my authority to issue Section 22 orders under the Health Protection and Promotion Act to extend certain actions that are necessary given what the city is currently facing. This will sustain the following requirements for a 28-day period when the province moves us into its new framework on November 14th. Indoor dining will remain prohibited at restaurants, bars, and food or drink establishments. Meeting and event spaces will remain closed, as will casinos, bingo halls, and other gaming establishments. And the prohibition on indoor group fitness and exercise classes will continue. In addition, I am making the following strong recommendations to you: that all social gatherings be restricted to only household members and 1 or 2 essential supports, and that you restrict your close contact to those you live with and your essential supports. This means limiting in-person activities outside the home to essential activities only: going to work or school, healthcare, shopping for your household and health needs, and exercise and physical activity. At businesses and workplaces, I'm strongly recommending that they implement work-from-home policies wherever this is possible. Review their heating and ventilation systems to ensure that they are in good working order, and appoint a compliance officer to ensure implementation of occupational health and safety and infection prevention and control measures. My expectation is that these measures and recommendations can interrupt the transmission of COVID-19. But what these measures and recommendations need is you. It takes you to do these things to make it harder for COVID-19 to spread. I recognize that these actions will have economic impacts, and I am truly sorry for this. I really am. However, in my professional opinion, the greatest harm would be to allow COVID-19 to continue to spread at this rate. It's logical to assume that it will only get worse. It's logical to believe that if we effectively reduce the spread, that the economy will benefit in the long run. If action is not taken, we can expect to see even more cases of COVID-19, which means more illness and more death. These infections could easily spread further through the healthcare system, to the long-term care system, to schools, and to workplaces. To everyone in Toronto, I want to warn you in the plainest possible terms that COVID-19 is out there at levels we have not seen before. You should assume it is everywhere, and that without proper precautions and protections, you are at risk of infection. We can't guarantee what the course of illness looks like. We can't predict what the long-term effects might be. People recover from it who you wouldn't expect to live through it. And people you'd think would come through it can die instead. I urge you to limit your contact with people outside your home setting as much as you can. Be strict about keeping at least 6 feet apart from people you don't live with, as much as you can. Be strict about wearing your mask and washing your hands. These actions will protect you. In good conscience, we simply cannot stand by and allow COVID-19 to disrupt Toronto without resistance. COVID-19 has the advantage right now because it's spreading from person to person, from people spending too much time together, too close, and for too long. The virus only needs that opportunity. For the next few weeks, I urge you not to give it that opportunity. I'll now turn it over to Brad, and we'll take some questions.
Thank you, Dr. de Villa. Just a reminder to reporters that you will need to unmute yourselves on WebEx. The changes to the WebEx platform require you to unmute yourself to ask a question. The first question is from Kelsey Mohammed at CBC News. Kelsey, go ahead, please.
Thank you for taking my question, Dr. de Villa. Are you confident that staying in a modified stage 2 for another 28-day period is sufficient to get things under control?
So in fact, we are working with the provincial government to move into the new framework effective November 14th. And what I'm suggesting here are the actions that are necessary in concert with what's prescribed in the framework in order to manage the risk that we see right now in our city. We know what it takes to control COVID-19. We know what conditions actually lead to ongoing transmission and spread of COVID-19. So through these actions we're taking here today, we're doing our part as government, and I simply ask the people of Toronto to do their part as well. We do have to do this all together. Success in terms of controlling and beating COVID-19 does rest with all of us.
Thank you. I also have a question for Mayor Tory. Mayor Tory, what are you encouraging Torontonians to do tomorrow, a day when we would normally gather in large groups to show respect for the fallen?
Well, what we are not encouraging them to do is to go to the places they will often go. For example, the Prospect Cemetery, which has a wonderful, very moving sunrise service, has asked the members of the public and politicians and media not to be there. They're having a very private service. We will have something at the Cenotaph where I will speak and we'll have the appropriate tributes paid there, but we're doing it without the public being there because, of course, to have a crowd there would be going exactly against what we want to do. So what I hope people will do is maybe it gives them a more meaningful opportunity than ever to take a moment at 11 o'clock on the 11th day of the 11th month and to think about those who sacrificed for us so that we could live in this wonderful city and country, and to think about the freedoms that we've seen are very fragile, and maybe there's a better opportunity in a time when people are going to be in their homes by themselves in many cases, or with their own family that they live with, to give some serious thought to that. So I hope that's what people will do, and we'll of course look forward to resuming more normal commemorations of Remembrance Day next year.
Okay, thank you. We
Thank
go next
you.
to Camille Caramale from Global News. Camille, go ahead.
Hi, thanks for taking my question, Dr. de Villa and Mayor Tory. I'll throw this one to you, Mayor Tory, if you feel like taking it. But my question's simple. Why wait so long when we've been seeing these alarming numbers and the number of cases rise day after day, week after week? But what took so long, and why even wait until Saturday? Why not, it's Tuesday now, why not shut things down ASAP?
This thing has been changing day by day, and I'll ask Dr. de Villa to speak to the medical and scientific aspects of that. It's been changing day by day. There are still many unknowns. Let's remember that we were in a 28-day program that others were in, which were the measures that everyone thought best to try and fight the spread of this virus at the time. And indeed, some of the numbers Dr. de Villa has made reference to today and some of the areas of more acute infection increase did show some improvement. We asked for extra time because we were not convinced at that time that as the clock was running out on the 28 days that was enough for Toronto. And so we had the extra time given to us by the provincial government, and quite frankly, we spent that time in light of the case numbers that have been increasing and other indicators we saw in Peel and elsewhere, developing the measures that you see brought forward today. So I don't think there was anybody that was letting any grass grow under their feet. We asked for extra time, we took extra measures, and today we've announced even further measures on the advice of Dr. de Villa to protect the city and keep people healthy. But this is something that changes virtually by the day, and I think we've been trying to remain as nimble as we can, knowing that you have to be careful about how you go about these things, and that it's not up to us to do it all by ourselves.
Thank you. Not much further to add. The mayor continues to become an honorary public health expert, it seems, over the course of the pandemic. He has it quite right. We did, in fact, implement some measures, as you know, in early October, and we did see some benefit, as I just discussed in my remarks this afternoon, as a result of those measures that were implemented in October. And we did see some stabilizing. We saw a little bit of a plateau. But in recent days, you're quite right, we've seen an increase in respect of cases. This was exactly what we had anticipated might happen, and we were concerned about that, which is why we did ask for extra time. And we're taking the action that's necessary now in order to control that which we're seeing. And of course, we're asking the residents of Toronto as well to participate in that action, to do their part, so that together we can actually beat this virus and finally put it behind us.
Thank you, Dr. de Villa. We posed this question to Premier Ford, and I'm just wondering if you can answer it a bit better than he did, or even Mayor Tory can. But just when it comes to, the color-coded system, a lot of people are incredibly confused by it, and now we're hearing it's a baseline for municipalities to make additional restrictions, like you just did, on top of. So how do you expect really anyone to follow along on this, especially if it changes when you go from one region like Toronto, then to Durham, or even Peel that has its own restrictions on top of the color-coded system with their own modifications? How do you expect your average person to follow along on this?
So, I recognize that there may be some questions, and some people may be interested in debating frameworks and what have you. But at this point in time, the way I see it, each medical officer of health has to actually make their ascertainment, to make their assessment of their community, and take actions, as we all do, in order to best protect the health of the residents in their respective jurisdictions. The way I see it is we're in a serious situation. As I mentioned in my remarks, we're seeing spread like we haven't seen it before. So rather than focusing on a framework or the terms of the framework, what I'm interested in doing is frankly getting down to action, making sure that we're doing the very best we can in order to control the spread of COVID-19, and asking for the assistance of the residents of Toronto in controlling COVID-19, in taking all the necessary actions, the actions that each and every one has to take in order to limit spread. Mr. Mayor?
Well, first of all, Dr. de Villa answered that question, of course, very well, but I think the one thing we have to remember is a framework is a framework. It's not a stone tablet, it's a framework. And it has in it ranges and other things like that, but it also has some language right on the document that I saw the day it came out indicating that you'd have to take into account the differing circumstances of each community, which is exactly what we're doing here today. Our responsibility, Dr. de Villa's, mine, Chief Peg, and all the others involved in the management of the pandemic, is to decide on top of the provincial framework what else is necessary. And I agree with Dr. de Villa. What was in place as of an hour ago and before we announced these measures was not enough to stop the spread of the virus. So we're doing more. And we're given the opportunity to do that in different ways. But, you know, I think people out there, they don't really care much whether it's a framework or a stone tablet or a stage, whatever it's called, stage document. They just want to see us doing what is right, doing what is necessary. They know there's a lot of unknowns. They know we're trying hard to do what's right, and they know that these measures brought forward today are brought forward in that very much good faith, based on expert advice and based on best practices from around the world. And I think that's what they care about, and I think that's exactly what they're getting.
Okay, thank you. We'll go next to Jennifer Paglero from the Toronto Star. Go ahead, Jen.
Hi there. My question's for Dr. de Villa first. I wanted to ask Dr. de Villa, in issuing the Section 22 orders, there was a lot of conversation earlier about whether you had the authority to, for example, prohibit indoor dining. And I just wanted to know from you what has changed in that thinking, whether you've received perhaps different advice or if it's because the public health situation has changed.
Yeah, I think what's changed here, Jennifer, is the urgency of the situation. The legal advice really hasn't. But we are seeing more spread of COVID-19. We're seeing rates we've never seen before, as you've heard me mention in my remarks. So it's a question of the urgency of the situation, what we know from the science, what we know from the experiences of other jurisdictions, what we know from our own experience is needed to control the spread of COVID-19. Hence, I've taken the actions, as I've articulated this afternoon, in the best effort to try and protect the health of the residents of the city.
It sounds like, and I'll look for, I know there's further details coming from staff to our inboxes, I take it, but I'm wondering, a lot of this is maintaining sort of where we're at now in terms of keeping indoor dining prohibited. And you know, we've heard that if the situation gets out of control, that the Premier would be willing to take parts of Ontario back into lockdown. But I'm wondering what out of control looks like for you, and whether kind of holding steady on the current restrictions is going to be enough.
Well, I think you'll notice, Jennifer, that there are some elements for sure that are about maintaining the current restrictions, but there are certainly some additions there in order to get better control of the situation now. I'm hoping that by taking this action today, this very clear, strong and decisive action, which was necessary, that we won't find out what it will be like or what it will take to get to lockdown.
Okay, thank you. And Jennifer, just so you know, and for other reporters, a news release and backgrounder will be issued very, very shortly. Next question is to Lucas Meyer from News Talk 1010. Lucas, go ahead, please.
Thanks, Brad. I'm not a lawyer, but I don't understand how a change in urgency should affect legal powers. So Dr. de Villa, I'm sorry, you just said that the legal advice hasn't changed. For weeks we were told that only the province could do this. I don't understand, if the legal advice hasn't changed, why you can do it now. Can you clarify that? And just to be clear, is it just indoor group classes that are banned, or just gyms completely? Thank you.
So let's start off with the second question first. It is the indoor group fitness and group exercise classes that will continue to be prohibited as we move forward into the new framework as prescribed by the province. And when it comes to why now, I mean, I've indicated already that, look, our situation is incredibly urgent. The risk is very, very high. And, you know, with extreme situations, sometimes those call for extreme actions. And we needed strong, decisive action. The legal advice hasn't changed, as I said. The urgency has. So, hence, I'm taking these actions as we move forward into the next stage of the provincial framework coming up this weekend. But that being said, I would absolutely encourage the strong recommendations that I've made to the residents of Toronto. Those should be taken up right now. These are actions that all of us can take in our daily lives. And it is, to a great extent, about the choices that each and every one of us makes. We can choose how to spend our time. We can choose how to limit risk and how to limit our exposure. I think if we assume that the virus is everywhere, then we know how best to take those protective measures. Limit your close contact as much as possible to your household. That's really what needs to happen. Only the most essential of activities that require in-person contact should be pursued at this time, because we know the virus needs us to spread. Let's not give it that chance.
Okay, well then, unless I'm corrected, then I'm going to interpret that as the city, in fact, did have the power the whole time to take these measures. But my other question that I wanted to ask was, because indoor, and this is kind of touched on before, but because indoor dining has been prohibited as well as the indoor fitness, I'm curious how you expect now that the gatherings are just recommendations, how you expect things to dramatically change when some of these measures have already been in place for a number of weeks.
Well, I think, Lucas, we've seen in the past, certainly from our experience in the spring, that when the people of Toronto understand and appreciate the circumstances and are called upon to do what's best to protect themselves and the community, that they do it. So we are calling on them to help us as we have taken these actions, the best, strong, decisive actions that are necessary, premised on the best available evidence and premised on the experiences of other jurisdictions. These are the kinds of actions that are needed in order to control the transmission of COVID-19. We're asking them to do their part as well. And we've seen them do it before, and I have every confidence that they can and will do it again.
Thank you. We go next to Francine Copen from the Toronto Star. Francine, go ahead, please. You have to unmute yourself. There you go.
Sorry, I was turning on my mic. Yeah.
Go ahead.
Hi. These measures have been in place since Thanksgiving weekend, the dining in restaurants and so on. And we're seeing these huge increases in cases and so on. I mean, from the point of view of the restaurants, what they're saying is, this isn't having the desired impact. So is this the way to go? Like, what's the evidence that this is the way to go?
So as you might have heard through the remarks today, in fact, we have seen impacts associated with the measures that have been taken to date, and in particular, the measures that were taken in early October. We had certain neighborhoods, and I just named two in the course of my remarks. Downtown neighborhoods where there was a lot of transmission of COVID-19, particularly associated with the hospitality sector and industry. And we saw cases literally going down from hundreds per 100,000 case rates that were in the hundreds per 100,000. One 275 per 100,000, the other one over 600. And they dropped into the double digits, 49 and 77 per 100,000. So we have actually seen the benefits of those measures. The issue is that we need more measures now because we are seeing spread and risk like we haven't seen before. Hence, we're taking this strong and decisive action, making sure that these measures continue to be there so that they can continue to have their effect, and then adding more on top of that, particularly asking for our public to participate by limiting all social gatherings just to their household and their essential supports. We know that COVID-19 needs us to spread. It needs us to get together in close contact with other people, particularly without masks, in order for it to get from one person to the next. So these are the kinds of things that we actually have the capacity to control together, and that's what we're trying to do here today.
Is there any evidence that schools are contributing to the spread of the virus?
So, when it comes to schools, this is one of the major areas of activity that we're most interested in protecting. We know that schools are incredibly important to our children, not just from an education perspective, but in so many other respects, from the social perspective and beyond, and the developmental perspective as well. And at this point, and actually throughout the fall, we have actually seen relatively few outbreaks in our school environment. And I think that this is due in large part to the incredible collaboration that has happened between the many, many partners that are engaged in the school setting, the school boards, the schools and the school communities themselves, and certainly the team at Toronto Public Health and other healthcare partners that have supported us, to say nothing of community agencies. It has been a monumental lift for all of these partners working together to do the best they can to provide as safe as possible an environment within our schools. And they've done a truly incredible job. We've had, in the range of 8 to 12 outbreaks at any given moment in time within schools. And in Toronto, we have, just around 1,200 schools just in the city of Toronto. And the level of outbreaks, frankly, has remained very, very low.
Okay, final question is to Scott Lightfoot from CTV. Scott, go ahead, please.
Thanks, Brad. Dr. de Villa, is there a concern that by keeping people out of restaurants, which have taken steps to ramp up health precautions, this will in fact push people into private homes? And I know you've asked people not to socialize, but I mean, just walk down a street on a nice day and you can see people are still meeting, going for drinks or dinner. Do you feel that by pushing them into private homes that where no one is monitoring these kind of COVID prevention protocols, that it could actually make things worse?
Well, I suppose that's always a possibility, and I think there are always possibilities for that kind of behavior. But in fact, as I mentioned earlier, in our experience, and based on our experience from the spring, we have seen what the residents of Toronto can do. And by and large, we have seen most residents of Toronto participate in the many sort of protective measures and the good actions that we're asking them to take in order to protect themselves and our community. I think most Torontonians are not interested in, risking their own health or risking the health of those around them that they love. And so that's why we're asking for this. We're doing our share as government and using the authorities and our abilities to the best extent possible, taking strong and decisive action. And now what we need is for people to continue to participate even more so than they have in order to prevent the spread. We know that if you don't connect with other people, you're not getting into close contact with people outside your home, this is one of the best things we can do together as a community to reduce that spread of COVID-19.
And just to follow up on that point, is this sort of the end of the road in terms of what you can do enforcement-wise or sort of legislative-wise, and the rest is up to people to make their own choices, make their own decisions?
I think we're constantly examining what our options are in terms of, in the context of what is actually happening in our city. And that never stops. That's just like any other physician managing their patient. You're constantly assessing the patient and thinking about what is the best course of action, what's the best treatment we can provide for the patient. That's no different in public health. So we're providing the best course of action given the current circumstances right now in COVID-19, and we'll continue to assess and make determinations on an ongoing basis.
Okay, thank you. I think Mayor Tory, you want to add a comment, and then we'll wrap up.
Only a comment to Lucas Meyer, because Lucas, you kind of negative optioned us on your final comment that you made after your second question, which is to say that if we didn't say anything, you would deem us to have certain legal powers and so on. May I just respectfully suggest the doctor's a doctor for her, and that's her good fortune. She's not a lawyer. I'm a lawyer that's far away from the practice of law. I think we have some very capable people in the City Solicitor's Department who will tell you that it is not a black and white matter like that, and would be happy, I'm sure, to talk to you about the criteria pursuant to which the Section 22 powers can be used successfully, but I'm sure they'd be pleased to have that discussion with you, rather than you drawing a conclusion that because because Dr. de Villa gave the answer she did, that therefore that there was any conclusion to be drawn from that.
Thank you, Mayor Tory. Thank you for joining us. That concludes today's press briefing. We'll return here on Thursday, November 12th. Have a safe evening.